Hi everyone. We're going to discuss limb lengthening. What is limb lengthening? This is a procedure that actually originated in Russia in the 1900s by Professor Elizarov. And originally this was being done with what's called an external fixator, which is almost like a metal cage that is connected onto the bone that has to be lengthened through the skin. And so this is really around your foot, ankle, leg, or arm for a relatively long period of time. It's fantastic because it can really address any sort of deformity or limb length discrepancy, but it is certainly very cumbersome. Over the past few years, a new, extremely exciting technology has been introduced in the market, and this is an internal lengthening rod. It's a rod that is inserted into the bone that you want to lengthen, and with a special outside magnet, the rod is activated and it lengthens about 1 millimeter a day. For the lower extremities, you can lengthen up to about 10 centimeters. When are you looking to have a limb lengthening? There are two main categories of patients. You have those that want a cosmetic limb lengthening, so patients that want to be taller. And then you have a more functional and reconstructive limb lengthening, which applies to patients that have one side shorter than the other. This may be due to a congenital deficiency, or it could be after a trauma, or sometimes after unsuccessful surgeries that resulted in shortening of a certain bone fragment. The exciting thing about this new technology is that compared to the previous generation of internal lengthening rods, you can walk on the extremities immediately after surgery. By lengthening 1 millimeter a day, you are really looking at doing lengthening sessions in your home with the special magnet 3 or 4 times a day. Sometimes as you lengthen these bone defects, you can start to develop tightening of the muscles and tendons and ligaments, which start to get stretched. And this can cause some temporary discomfort or pain in one of the joints above and below that bone to be lengthened. And sometimes the pain just becomes too intolerable, for which reason we may have to suspend the lengthening temporarily and then resume it later on. In more infrequent cases, the lengthening has to be stopped once and for all because the body just doesn't tolerate it. This lengthening rod remains inside your bones until the bones are fully healed. And then we recommend removing it because it is a rod that, again, incorporates a very strong magnet, and this may prevent you in the future from having, for instance, an MRI for whatever reason. And so we typically remove the rod about 9 to 12 months after the procedure. The lengthening procedure for cosmetic purposes is also a very successful one. In the United States, lengthening for aesthetic purposes alone is not covered by insurance, and therefore this unfortunately has to be covered out of pocket. Whereas the lengthening in patients that have a functional deficit is normally covered by most insurance plans. The postoperative recovery varies a lot. It depends on how much you need to lengthen the bone. Some patients have to lengthen just about half an inch, and other patients go all the way to 3-inch lengthening. The more you lengthen, the longer your recovery is going to be. Physical therapy becomes extremely important in patients undergoing this type of procedure because it helps loosen up the tight muscles and tendons and ligaments, and it helps maintain a good range of motion of the joints above and below the bone that you are lengthening. Patients typically spend a couple of nights in the hospital after the surgical procedure that takes about 1.5 hours. And again, you can start walking on the affected extremity as soon as you feel comfortable after surgery. What are the possible complications of limb lengthening? These can range from temporary issues such as tightness of the joint, tightness of the muscles and the ligaments and tendons. They can be associated with a temporary nerve irritation because as you lengthen the bone, you're also stretching the nerve, which may get a little annoyed with this process. And then you may have more concerning complications, such as the bones that you're lengthening are not healing. And so this may either require just giving it more time. Sometimes it requires injecting some growth factors using a needle during a very short surgical procedure. And other times it may actually require putting bone graft in the bone that is not healing and replacing the hardware. Other possible complications, especially if you're lengthening your thigh, can be a dislocation of your hip joint. Fortunately, this is quite rare, but it's certainly something that we need to keep an eye on, which is why when you do limb lengthening, we take x-rays every 1 to 2 weeks to make sure that the overall alignment of your extremities is maintained and that everything is progressing as desired. Patients who are interested in looking for limb lengthening should consult an orthopedic surgeon who has fellowship training in limb lengthening and deformity correction. Most of these surgeons you will find in academic institutions, but you may be lucky enough to have a surgeon who is closer to where you live and work.